Imagine the symptoms of autism, cerebral palsy, Parkinson's, epilepsy, and anxiety disorder, all in one child. This is Rett syndrome. Now, imagine those horrific symptoms gone. The Rett Syndrome Research Trust now has a plan to achieve just that. Roadmap to a cure. This roadmap is the culmination of years of research. We've been building up to this point since launching in 2008. Now we're here. Now we know the approaches that will get us to a cure. Now is the time to go all in with our financial resources, our energy, our commitment. Join us for the next few minutes and see how our roadmap to a cure will change 350,000 lives. Cure is the roadmap's core destination. Our comprehensive strategy strikes at the root cause of Rett syndrome, Mecp2, with 4 distinct paths. Gene therapy is the closest to clinical trials and is our lead program. The concept is simple: deliver healthy copies of the Mecp2 gene to compensate for the mutated ones. Theoretically, a single gene therapy treatment would be a one-time fix. We anticipate that gene therapy should lead to profound improvements regardless of age. Our gene therapy consortium has developed an effective treatment in animal models in just 3 years. Over the next 3 years, we have 2 main goals: to launch a gene therapy clinical trial for Rett, the first such trial ever, and support of a second-generation gene therapy program to leverage all advances being made in the field. Path 2, Mecp2 Reactivation. Girls with Rett have 2 copies of the Mecp2 gene. One is on the active X chromosome, and the other is on the inactive X chromosome. In every cell where the mutated gene is active and making defective protein, there is a healthy but dormant copy of the gene on the inactive X chromosome. Wake the dormant gene up and, theoretically, Rett is cured. Mecp2 reactivation is an exciting approach because there is a healthy copy of the gene in every cell. We don't have to deliver it. It's already there. We just have to find a way to wake it up. What began with a single lab working on this approach 8 years ago, with RSRT funding, has now grown into a dynamic consortium. That consortium's mission over the next 3 years is to pursue existing reactivation drugs while also discovering and developing new ones. RNA editing holds profound potential, but until recently has remained largely theoretical. Targeted RSRT funding has demonstrated dramatic potential for correction of Mecp2 mutations at the RNA level. RSRT is increasing investment in aggressive pursuit of RNA editing breakthroughs. The goals over the next 3 years are improving efficiency of RNA editing in the brain and identifying optimal delivery methods. RSRT is collaborating with a biotech company that has developed a technology to deliver proteins to the brain. We will simultaneously monitor, evaluate, and pursue worthy alternative protein delivery approaches. Our roadmap to a cure strategy targets all 3 stages of the gene-to-protein process, substantially increasing probability of success. Importantly, all these approaches will work regardless of the type of Mecp2 mutation or deletion that an individual with Rett has. Now on to the treat section. Cure is the roadmap's destination, but en route, we will also monitor treatments that have potential to improve quality of life for those with Rett. These therapeutic approaches do not directly target the root cause of Rett, Mecp2, but rather the resulting downstream effect of the mutations. All current and past clinical trials for Rett fall in this category. While these drugs will not be a cure, they may improve symptoms and quality of life. RSRT monitors all treatment development programs and will selectively invest in those with the greatest potential for significant impact. Critical knowledge gaps need to be bridged if we are to enable the biotech and pharmaceutical industry to invest in Rett syndrome. To remove obstacles, RSRT will work closely with Rett physicians to develop FDA-approved assessments called outcome measures, help identify the right patients for the right trials, and develop a biorepository of patient cells to test new therapies in the lab. Our investment in basic science has paved the way for the innovative, curative strategies we are now pursuing. The pace of discovery in science is happening at an unprecedented rate. RSRT will continue to learn and to put novel technologies and scientific breakthroughs to work on behalf of our children. Roadmap to a Cure for Rett Syndrome is bold, ambitious, and, with your help, achievable. We now have a clear path to a cure, but we can't travel it alone. The roadmap costs $33 million, and to raise this amount of money quickly will require a global grassroots effort. Together, we will empower each other to mobilize our communities and generate the funding needed to free our children. There are lots of ways to fundraise, and we can help you to find the one that is just right for you. Armed with love for our children, grandchildren, sisters, nieces, friends, and neighbors with Rett, we can do this. Please contact us, and let's get started on our roadmap to a cure. Visit reverserett.org/cure.